This meeting is being recorded. All right. Today is September 11. Welcome. Shane has started the recording. Thank you so much. Um, Before we begin this meeting officially, I would like first to take a moment to pause and reflect. Okay, on this day, September 11, we honor the memory of the victims of September 11 attacks and pay tribute to first responders, healthcare workers, and countless individuals that showed extraordinary courage and resilience. So let us please observe a moment of silence in their memory. Thank you so much. Thank you for observing a moment of silence. So to continue, the meeting materials have been posted online and emailed to commissioners and work group co-chairs. Once again, my name is Dr. Oluwatosin Olateju. Welcome to our September 11th virtual-only meeting hosted by the Maryland Commission on Public Health. The presiding co-chair for today is me, but I'm joined by my co-chairs. I know Dr. Mina Brewster is online. I'm not sure if Dr. Boris Lukshner is on. Please signify.
Yes,
But
I
I'm
am.
joined. Oh, awesome. Thank you. Welcome. So I'm joined by my coaches who will be contributing to the flow of today's meeting. Also assisting today are the commission support staff, including Michelle Kong, Jonathan Mesfin, Chidobem Egoluche, the team from CDC Foundation, including Shane Atchett, our commission's senior advisor and manager, Sarah Bora, and Megan Rooney. We also have Dr. Dushanka Kleinman, technical advisor and professor emerita from University of Maryland School of Public Health. And, Dr. Amelia, I know, saw on the call, Dr. Amelia Araya, and other academic representatives on this call. So we appreciate everyone that has joined us today, and we followed all the requirements to post this meeting announcement online. For those that are joining us for the first time, um, just know that you can find the meeting materials on the Commission's website, which is health.maryland.gov/COPH. You can also follow us on LinkedIn, we're Maryland Commission on Public Health, and on Instagram, our handle is md.coph to stay abreast with our activities. So I'll start with some housekeeping items. Commissioners and work group members, please make sure you sign in by typing your name. You can start now, type your name and work group affiliation in the chat box for our records. Other, group members, as noted, can please type their names in. Commissioners are welcome to unmute their mics as needed to ask questions, to share their comments, and participate in the discussions throughout the meeting. I kindly ask all commissioners to please identify themselves before speaking during the meeting so we can know who's talking. Given our tight schedule, we ask that members of the public and other non-appointed commission members please hold off on their questions, but rather send those questions to our email. If you must, indicate a question, then you can please type it in the chat box for our facilitator to answer. I would now ask Shane to please conduct a roll call for the commissioners. Thank you.
When I call your name, please respond with here or present. Delegate Heather Bagnall, Camille Blake Fall, Christopher Brandt, Mina Brewster,
here,
Jean Drummond, Senator Clarence Lamb,
here,
Deputy Secretary Alyssa Lord,
here,
Boris Lushniak,
Here.
Tosin Olateju,
Here.
Maura Rossman,
here,
Nicole Rochester, Michelle Spencer,
Here.
Dr. Elizabeth Crum on behalf of the Deputy Secretary,
Present.
Alan Twigg. We have a quorum.
We do? Okay, that's awesome. Thank you so much, Shane. And for the record, quorum is 50% plus one of commissioners present. So the next item is adoption of the agenda. As mentioned earlier, all the meeting materials have been posted and emailed. I'll now entertain a motion to approve the agenda.
I make
I
a
move.
motion.
Namora, thank you.
I second.
And who's that? Sorry.
Michelle.
Oh, Michelle, thank you so much. Thank you. All right. All in favor, please say aye. If there are any nays or abstention, all in favor of the adopting the agenda, please say aye.
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 Aye. Okay. Thank you so much. If you haven't spoken or if you're unable to speak at this moment, please type your comment in the box. All right. If there are none, the motion is approved for the adoption of the agenda. I'm going to move to the next item, which is minutes review. That's the August 21st minutes, meeting minutes review and approval. Right. So like I said, you have all the materials. I'll direct your attention to just review it briefly. Let us know if you have any comments or requests for amendments. All right, I don't see or hear any comments. All right, so I will entertain a motion to approve the August 21st meeting minutes.
So moved.
Thank you. And just for the recorder, I know that came from a room. Can I know the name of the person that moved?
Sure, that's Mina Brewster and the.
Oh, Mina. Okay. Sorry. Thank you.
No worries.
If everyone, yeah, thank you so much. And can I get a second, please?
Second from Boris.
Oh, thank you, Boris. All right. Are there any nays or abstentions? All right. It looks like the minutes has been approved. Thank you so much. So before we move on to the next item on the agenda, which is final adoption of the recommendation slate, I just want us to take a moment pause because it's important to express, gratitude. So I want to use this opportunity to express my deepest gratitude. Today is a milestone, right? One that began June 1st, 2023, with very limited resources, yet an unwavering commitment to public health. From the starting point, we've come to this moment, presenting the final recommendations as a slate, and that the commission was charged to do, right? So this would not have been possible without the dedication of so many of you. Some on this call, some today, and some are not. To my fellow co-chairs, I just want to say thank you so much for riding on this journey since 2023. To our commissioners, our commission support team. I mean, they're just awesome, incredible team. Thank you so much for your tireless leadership. To our work group co-chairs and our members, to our academic partners from University of Maryland School of Public Health, Coppin State University, Morgan State University School of Community Health and Policy, Johns Hopkins School of Public Health, to our interns, thank you so much. To the CDC Foundation, right? I know Dr. Judy Monroe is on the call. Thank you so much for your leadership. You did this before and you're doing it again. And I know it's not going to stop with Maryland. So thank you so much. To the Commission's financial donors, through the CDC Foundation, and those include the Bloomberg Philanthropies, Kaiser Permanente, the Kaiser Permanente Fund at East Bay Community Foundation, the Crexy Foundation. We just want to say thank you to each and every one of you. So Nature, the Beaumont Foundation, the Maryland State and local departments, and many speakers that have shared their expertise along the way. Your contributions have been invaluable. We just want to express our appreciation And to all the colleagues in various public health organizations, right, across the states, and the nation, and to members, that just joined to engage from other states as well. Just thank you so much. We're very fortunate to have such passionate and dedicated experts, despite many blows, right, that public health has faced nationally. You are still here. You've continued to help us move forward, with the resolve and determination to get this far and to complete this work. And without each and every one of you, we simply will not be here today. So on behalf of the entire Commission on Public Health, I want to sincerely thank you for making this day possible. So now to the next item. I'll now call on Shane to introduce the recommendations by themes and offer discussion for particular items as requested by commissioners, after which we'll take the votes. Thank you so much.
Thank you, Tosin.
Sure.
So as, excuse me, as Tosin mentioned, we have posted the materials for the voting today on the website and shared it in advance with the commission members. Commissioners, you should have received instructions on how to access the polling software that we've used previously. So the information should have gone to your inbox around 1:40 this afternoon. If you want to go ahead and start logging into that, we can work on getting our logistics set up here. We will be voting on the recommendations by theme, with one exception, recognizing that the first theme of strengthening public health infrastructure is pretty significant in the number of themes, which I think is a testament to the works of the different work groups and our assessment partners in terms of identifying all those areas that we have an opportunity to improve the investment and build out of structure for public health. We'll break that into the 3 sub-themes as well, so that it'll be a little easier to work through those in a more wieldy way. So as a reminder, those 3 sub-themes under the first theme of building the public health infrastructure or strengthening the public health infrastructure are leadership and governance, human resources, and funding. And I'll have those pulled up on the screen here as well. But otherwise, that's how we'll be doing it today. So we'll take a total of 7 votes as we work through this. The options that you will have to select are yes, the slate is adopted. No, the slate is not adopted, in which case I would presume that there will be a dissenting comment filed, and more instructions on that will be shared after the voting is concluded. And then abstain, which if for any reason you need to recuse from voting or feel that you're not able to fully participate, that is an option. You would not necessarily need to file dissenting comments. Just a note that the dissenting comments per statute will be included in the final report in their entirety, so it will become a matter of public record. Any questions about this before we jump into the voting process? Okay. So the first theme that we'll be voting on is strengthening public health infrastructure, and specifically the sub-theme of leadership and governance. This includes the recommendations as updated through public comment and different iterations and conversation along the way. So we have shared governance, co-creation framework, shared health outcome metrics, public health foundational and behavioral health services, local public health surge volunteer pipeline, which is italicized and has an asterisk here because it substantially changed from the last time that you folks saw it. This originally was the recommendation to appoint a statewide volunteer coordinator. However, after conversations with the Maryland Department of Emergency Management and the Maryland Department of Health Office of Preparedness Response, We realized that the language could be updated and tightened a little bit so that it didn't feel as duplicative as was originally brought to our attention. The Maryland Responds MRC expansion is another recommendation included in this. The environmental health system, racial equity impact assessment for the executive branch, racial equity impact assessment for the Maryland General Assembly, MDH public health grand rounds, local health department accreditation, and listservs for local health departments. Those are all of the recommendations that would fall under this theme and sub-theme, and we will now open the conversation for discussion.
My apologies, Shane, but did you say that only the ones italicized are the ones that were revised during the public comment period? Or indicate that?
No, I apologize. We identified the ones that were significantly changed from the last version that was shared with the commission. So you may recall that at the August 21st meeting, we shared I think it was version 11 of the slate. So these ones that are italicized are significantly different from that version, and we've flagged them for commissioners just to be aware. Thank you, Mina.
Thank you.
Thank you, Mina.
If there are no concerns or questions to bring up, we can certainly open voting, but I don't want to cut the conversation short.
It's almost like you read my mind, Shane. I was just gonna tell people to start getting their phones ready and, go to the Vivox app, or, if you're using your phone or your computer, because, in case people encounter technical difficulties with that. Thank you.
If I may, just a quick question. Is there any concern, given the current federal climate, around the language related to the racial equity impact assessment? I don't disagree with the concept or the need, but I do have some concerns about the utilization of the language, given much of the federal guidance that we've received.
Thank you so much, Lisa. Thank you.
And Delegate Bagnall, you were polite and
Delegate-
raised your hand. I'm sorry if I jumped
Yes.
you.
Yes. And I also, I also welcome, let me see here, anyone, with expertise in that field. So please, yeah.
This is Barbara Brookmeyer from the Governance and Organizational Capabilities Work Group, serving as the chair. I think we would view it as a friendly amendment if it actually were to say equity impact analysis. In fact, I'm not sure when racial got added to that, but an equity impact assessment would be sufficient, because we all understand in public health that we're talking about equity in a number of dimensions: geography, age. It was not intended to be limited to racial equity.
Thank you so much, Dr. Brookmeyer. And, I know Camille Blakefall, in case you want to share your thoughts on this, I know the Commission on Health Equity. This is, one area that they might have touched on. So please, we welcome your thoughts, if any. And you're also welcome to send us an email about that maybe later. Yeah, thanks.
Thank you, Olu, for the invitation. I don't want to jump Delegate Bagnall, though, who's had her hand
Oh,
up.
yes,
I'm
yes.
happy to share just a
Please.
few comments after, but Delegate.
No worries. Please call me Tosin. Thank you. Please, Delegate Bagnall. Thank you.
Thank you so much. Secretary Lord, we did actually have a fairly robust discussion about whether we needed to be thoughtful with our language and careful. But Senator Lamb and I both spoke to the fact that this is being presented to the Maryland General Assembly, not necessarily to the federal government, and we'll be making recommendation. We'll be evaluating the recommendations, and so we would not put in legislation that we think would run afoul. And obviously, we would be working closely with the department to make sure that nothing that we were doing in response to these recommendations would jeopardize our funding, jeopardize our state agencies, or jeopardize our Marylanders. And so we do look to your expertise, but I also know that there was a concern about trying to be proactive or reactive, because we don't know from day to day what the new language that's going to be targeted by this federal administration is going to be. I hope that helps, and I see that my Senate counterpart also has raised his hand, so I don't want to speak on his behalf.
I'll
Sure,
just quickly.
if I could just jump in to tag on Delegate Bagnall's remarks. Is that okay?
Sure, Senator.
Yeah.
Go ahead.
Please.
Yeah,
Senator
I mean,
Lamb.
I think
Yeah.
I agree with what Delegate Bagnall was conveying as well. And I think we'd spoken about this at an earlier meeting where, the intention of the document and this report is to be a living document for us to be able to refer back to. And while it'd be great if we could address all of the recommendations in this report over the next year or two, in all likelihood, the work on this will continue and probably continue into the next administration as well. And so, to Delegate Bagnall's point, I think the intent here is to put out what you think would be the ideal from a public health standpoint, knowing that this is going to be a report that should outlast this administration and probably last into the out years too, that we can always refer back to as a General Assembly and legislature to pick up on additional recommendations to work on. And so certainly understand the circumstance and sensitivities of that, but just kind of bear in mind that hopefully there's some longevity to this report as well that spans beyond this current administration.
Thank you, Senator Lamb. Camille, do you have additional comments? And I'll take somebody from the room. Thank you.
Just quickly wanted to offer, in terms of a statewide landscape, the Department of Legislative Services, DLS, already conducts racial equity impact assessments for all criminal law bills. And they've done that for years. And to the best of my understanding, they have not stopped doing their racial equity impact assessments since the start of the federal administration. It's been a long-standing practice, but it's been reserved to just criminal law bills. And so I see this recommendation as an expansion of existing work. And so that's definitely at the legislative level. So that would include, the General Assembly, obviously. That doesn't necessarily extend to the executive branch, but it's an outgrowth of what currently is an standard operating procedure, again, for criminal law bills. So and additionally, I agree with Senator Lamb and Delegate Bagnall that this is a document that hopefully has longevity and it will be consistent with what DLS is already doing and expanding on that.
Thank you so much. All right. I know we have somebody from the room. Yeah, from the conference room. Please go ahead. Thanks.
Hi, it's Mina Brewster. Thank you,
Hey,
Tosin.
Mina. Sure.
Hi. Just in response to the comment from Barbara Brookmeyer from the GOC work group that put forth these recommendations for consideration. I'm not sure if there was a subsequent discussion that narrowed the equity impact assessment down to just the focus on race. But
Hey, come on, Ayla, come on and call
if it's
until 5
appropriate,
o'clock or maybe late, short.
we can certainly expand I would move to amend the language to just say equity impact assessment for each of those two recommendations, GOC 061 and GOC 062.
Thank you, Mina. Do we have a second for that motion? And then we can take discussion on that. Thank you so much. Yeah. The motion is to take out the ratio in front of the.
Second,
thank you. Yeah, thank you. All right. For both 061 and 062. Thank you.
Sorry, who was the second on that?
I think it was Senator.
It was Maura.
Oh, Maura? Okay. Thank you, Maura. Thank you. Are there any additional comments about that? And then we'll take a vote. All right, we are moving along. All right, all in favor of the amendment of GOC 061 and 062? We're going to do it together. Please raise your hand or indicate by saying aye.
Aye.
Thank you, everyone. Thank you. Any nays or abstention on the amendments put forward? Okay, see none.
Tosin, I'll abstain.
You abstain? Okay, Camille abstain.
Yeah.
Thank you. All right. At this point, I'll give the floor back to Shane. Thank you.
Right. Any other items for discussion, or are we comfortable moving to vote on the slate as is presented on the screen here with the recent amendment passed? Okay, I will open the poll. Seeing one person's vote. Okay. The slate passed 7
Awesome.
to 3 abstentions.
All righty. Awesome. Thank you, everyone. Okay. And then we can advance
The
to the
next theme that we have is, or excuse me, the next slate to consider is theme 1, strengthening public health infrastructure, and specifically the human resources sub-theme. This includes the recommendations to implement the state personnel task force recommendations, local health department access to state job classifications, establish Maryland Department of Health and local health department specific job classifications, commission a study or create a commission on local health officer and Maryland Department of Health human resource system autonomy, legal protection of public health employees, appointing a statewide chief nursing officer, creating a local health department assistance and support bureau within the Maryland Department of Health, establishing a Maryland Department of Health grant management team, and creating a public health resource team within the Maryland Department of Health. We'll
Thank you,
now
Shane.
open the floor for
I
discussion.
see Dushanka has a hand up. Thank you.
Hello. I just wanted to bring attention to the wording of the recommendations that we just voted on for the race equity impact, because the actual recommendation itself speaks to ensure racial and health equity that are central to the development, implementation, and evaluation, etc. In both the executive branch and the General Assembly. So the intent is large because the label that we have really is a call out of the quote product, which is the assessment. So in essence, the recommendations stand as they have been written, but the label just is shifted to equity impact assessment. The content still will preserve and ensure racial and health equity are central in those products. So I want to make sure everybody realizes that the support that we gave to those recommendations still are strong and wording has not been changed. It's only what we're calling the title of the recommendation that has been altered.
Thank you so much, Tushankar. Are there any comments about that? And then I can, do we need to, to take a motion and vote on this, or is there a general understanding, especially because the title has been altered? And, I welcome the commissioner's thoughts on this. Do you feel we need to take a vote on this, or is everyone okay with us proceeding with the understanding that the recommendation keeps its intent, right, to be inclusive of equity and race in its entirety? Mina, or yeah?
Thank you. Yes,
Sure.
I guess I'm a bit confused by that because in the materials that were disseminated for the meeting, when you read the actual recommendation on page 7, the language of the recommendation refers to it as a racial equity impact assessment policy before it says to ensure racial and health equity. So I think the intent of my motion was to revise that to be, in the first recommendation to say an equity impact assessment policy to ensure racial and health equity, right? So, and the same with the second one, that in the first part of the recommendation, it calls out a racial equity impact assessment policy. So to change that to an equity impact assessment policy to ensure racial and health equity are central in the development, implementation, and evaluation of proposed legislation.
So would we still keep the word racial in the title then for both?
No.
No,
well,
okay.
I mean,
It would
it's
still,
up
okay.
to, I
Okay.
think it would be up to my just to clarify, the intent
Okay.
of my motion was to keep it broader and
Broader,
to
yeah.
use the word equity without further specifying it down to racial in both the title and also
Yeah.
in the first
And in
phrase
the
of each of
first
the
phrase.
recommendations, where it's specifically described as a racial equity
Racial.
impact assessment.
Got it. Okay. Understand.
So that it's
All right.
inclusive of racial
Yes.
equity, but it's also more expansive than that.
Okay. Okay, thank you. Are there additional comments about that? Okay, just for the record, I would prefer that we make another motion and vote, just so there's clarity, and I can state that, and it encompasses all the the changes. So I move, right, to accept the title change to remove racial from which I think we already made that motion, but also the first paragraphs of the two recommendations GOC 061 and 062 to change A to and remove racial from both so that it's more inclusive. Can I get a second for that? And we'll take a vote on that.
Second.
Second, thank you, Mina. And all right. No other comments, or are there any other comments on that before we take a vote? No? Okay. So all in favor of this additional edits, please say aye.
Aye.
Aye. Okay, thank you. Thank you, Boris. Okay, and if you want to abstain, please let us know.
I'll abstain. This is
You
Camille.
abstain? Okay, all right.
Yes,
Thank
thank you.
Camille. Any nays? Okay. All right. Thank you, everyone, for the invaluable discussions. Very nice. Thank you. All right. Are there any other for this next set of recommendations on the screen that are part of theme 1? Are there any other discussions? If not, we can move to the next next part of it, which is to take the votes. I'll pass it on to Shane.
Thank you, Tosin.
Sure. Mhm. We're just waiting for the poll and then we'll move on.
Right, if there's no discussion, I will open the poll.
Thank you. All right.
Just waiting on 2 more.
Okie dokie. Thank you.
The slate is adopted. 8
Awesome.
yeses to 3 abstentions.
Thank you so much, Shane. We would go to the next slide, which is the third part of theme 1.
Okay. Our last subgrouping within theme 1, strengthen public health infrastructure, is funding. And the recommendations included here are revisiting the core funding model assessment, procurement and contracting efficiencies, grant flexibility, Medicaid reimbursement task force, population health related funds, which again, this one changed substantially since the last version of the slate that you saw, based on where we believe the current conversation is around the ahead payment model. And we're still working with the HSCRC to figure out what exactly the contours of that look like. So in the meantime, we have restructured the language in this to be a bit broader, but still within the general spirit and intent of the original recommendation. Additionally, charitable foundations, health communications development and dissemination, information technology funding, and community health needs assessment support for local health departments.
Thank you so much, Shane. And just to direct our commissioner's attention, the language for the CCR 063 is on page 11 of the recommendation slate. Thank you. I think Dr. Crum has a hand raised.
Thank you. I just wanted to, excuse me, comment on the Population Health Improvement Fund. So if you're working on, final language with the HSCRC, that's great. But I just want to be clear that Population Health Improvement Fund is tied specifically to our state agreement for the AHEAD model. And so it talks about that we can only use those dollars for specific items with the goal that are tied to the goal of the model. So it doesn't offer as much flexibility as this might imply. So I would just really strongly encourage that we get that language right. So I don't know if they've given you a time frame for this, but that fund is jointly administered between the HSCRC and MDH, and it is linked to what we're required to meet in terms of population health outcomes for the model.
Thank you, Dr. Crum. Do you have a particular language in mind, or is it something that maybe later that you can maybe work with our team to review? Or if you have it now, it'd be a wonderful time. Maybe it's a matter of just rephrasing that. And, you know, for others online, it's not on the screen, but we can see it back, and that way we can, you know, it will help so we can take the vote as a slate.
I don't know if Mina, I see her hand up, so I just
Yes,
want to.
Mina, yes.
Thank you. I was just going to say, thanks so much, Dr. Crum, for that input. I think that's really helpful. And that's partly why the language was broadened a bit, so that it wasn't as specific as the original version, because we didn't want to conflict at all with whatever emerges and, you know, changes, I guess, to the CMS agreement language and so forth. And we were waiting on some response from the HSCRC to help guide as well. But I think it would be really helpful if, as you're looking at the specific language of the recommended revision to that, since we're voting on them now, if in reading it, you see anything that might conflict, perhaps we can revise that now. But again, it was broadened in its language to be less you know, prescriptive or less specific than its original version.
Thank you for the
Right.
additional insights, Mina. Yeah, please.
No, I totally understand that. I think the problem is that it is actually very specific, this fund, and it's tied to the current signed agreement we have with CMS that outlines what we can spend the dollars on. So, and we're in the process now of renegotiating all of this. So that's where I think great that it was brought in, but it doesn't quite hit the mark because it is very narrow with the tie to the state agreement. So I'm not sure exactly what to offer, because I would, with this is not a recommendation that I would, as it currently is written, would support. So I don't know how to remove it without honoring what you're saying in terms of the intent of the sort of larger scope. So if you're comfortable with it and moving forward, there's also, I mean, the one thing you could do is remove the state health equity plan from it, because there is no longer a state health equity plan requirement under the AHEAD model.
And that would be on, let me see here, state health equity plan. So can you just read out how, so is that the part where the commission supports orienting the population health improvement fund to operate, and then it goes down with the vision and goals of Maryland's payment model, state health improvement plan and emerging state health equity plan. So take out state health improvement plan.
So I think it would just be in alignment with the vision and goals of Maryland's payment model and the state health improvement plan, and then period.
Okay. Yeah. And the state health, okay. So take out the state health equity plan. Okay.
Yep.
All right. Are there additional comments about that? You know, thank you so much again, Dr. Crum and Mina and everyone. If there are no additional comments, I'll pass it on to Shane so we can take the poll. Oh, okay, Mina.
Do we need to vote on the amendment of that?
Yes, I think that's a good idea. Yeah. Thank you, Shane. Mina?
Yeah, so I don't know if you want me to do it now or after the
Yes.
Motion happens for the amendment, but if you want me to mention it now,
you could. Go ahead.
You know, I think it's really important that we get this right. We have this is a big deal for Maryland. It's a big deal that would have an impact on public health. We have reached out to the HSCRC and are awaiting hopefully some guidance from that commission on this language. And so if, you know, our intent with today's meeting was to approve all the recommendations so we can finalize the last couple of weeks of developing out the final report. But I'm hesitant to not include a recommendation around the AHEAD model and the importance of the AHEAD model and being informed by public health professionals at state and local levels. And I don't mean the model itself as much as the administration and the work that may be tied eventually to the Population Health Fund. So I would recommend that we give the HSCRC a little bit more time to respond to our outreach and hopefully finalize this language so that it aligns with MDH and HSRC as the administrators of the Population Health Fund based on the statute that was enacted last session. And if there is an ability to postpone voting of this to either electronic voting by email or voting at the final meeting of the commission, we can still develop out the portions of the report related to it, but maybe the language will be tweaked to be exactly what makes sense. I don't know.
All right. Thank you so much, Mina. Can we take that as a motion, and we can get a second on that? So, which is to yes, thank you. Can we get a second on that? Which is to we can vote on the others, but delay voting on that particular recommendation until the commission hears back, from the HSCRC, and then we can send out a vote by mail if we can get a second on that.
Point of order, we would need to vote at the 25th meeting in order to comply with the Open Meetings Act.
Oh, I see. So at this point, I would like us to vote on the slate as is. I would like us to vote on the slate as is, noting that the commissioners, right, they have an opportunity to share their dissenting comments, which will go into the final report. And there is a process, regarding that, which we will share. So at this point, just to move on, I am saying that we should vote on the slate of recommendations as presented. Thank you. All right, Shane, please go on. Just so that we can be in accordance with the statutory requirements for the commission. And once the poll is open, we will take a vote on that. Thank you.
Sorry, Tosin, just to clarify, because I guess, sorry, I landed in a slightly confused spot. Are we voting on this entire slate with the amendment that Dr. Crom was recommending to the recommendation language of Population Health Related Fund?
No. So it will be as is, the language as is, which is to not exclude to not exclude emerging state health equity plan. So to leave it as is, and then people have the opportunity for to share, because Shane noted, just so that we can meet the deadline, unless there are other thoughts about that.
Well, I mean, our previous we did make a revision to the language in the previous set of recommendations, and we voted on that by removing the word racial. So I think we do have an opportunity to revise the language of that to remove state health equity plan, as Dr. Crom was recommending, before we vote on the whole slate.
Dr. Crom, are you okay with that?
The only thing I was doing was just calling out that the state health equity plan no longer exists as a requirement of this model. So it's just factually incorrect, but also this is a point in time, right? So words and other things, they change over time. So for the purposes of voting for the slate, if you feel like it needs to stay as is, that's fine. Just know that component is no longer part of our ahead model requirements.
No, thank you. We can certainly remove that, So the recommendation would be to take out emerging state equity plan. Yeah, that's fine. And Shane, please, we can proceed with the vote. Thank you. Okay, thank you.
This is Boris, just a point of order. So I think the process, just so I understand it, may be first to amend, according to Dr. Crum's recommendation, the language, right? I mean, I think, it's hard to crystal ball all this, but what I don't want is to have a report coming out that, per Dr. Crum is factually incorrect, right? So somebody, if we are going to sort of leave an impact, we want to make sure we got it, right? We got it right.
So, yeah, thank you, Boris. Just
So
to
I would
state,
almost propose that we vote separately on an amendment, amending the language, and then go back to the slate.
you want us to
So
vote
taking
on amendment? Okay.
Dr. Crum's recommendation
Right,
that
as a vote,
drop-
absolutely.
vote
Okay.
as a commission on that to make the change like we did in the
Okay, absolutely. That is
and then
fine.
go back to the slate.
That's
right?
fine. Okay,
You know,
thank you,
I
Boris.
also, going back to just sort of the comment that Mina and others are making is
Yeah,
at the end, we want to be impactful here. So what I don't want to do
absolutely.
is us going the opposite direction, saying, oh, this is too complicated and we're going to drop it.
Yeah.
If nothing else, it'll be a placeholder.
Yeah,
If we can get language corrected, for the meeting of the 25th, we may
Yeah.
have to just bring it up and do a last minute audible,
Right.
change. It gives us a few days
Right.
to change in the thing and get it right from to make sure the language is perfectly correct. But this is a powerful recommendation, and so
right,
therefore,
absolutely.
that's my feeling. Over.
Thank you, Boris. As long as the language that we're changing does not change the intent of the recommendation. So at this point, Boris, can we take that as a motion, and then we can get a second, and then we take a vote on that? Thank you. Okay.
Yeah,
we'll
I
take
so
that.
move to take Dr. Crum's recommendation to
Okay.
drop the language of.
Okay. Okay. So drop the language, which is, and the emergent state health equity plan. Thank you, Boris. Can I get a second on that?
Second.
Okay, thank you, Mina. All right. So all in favor of removing that language but keeping the rest of the recommendation, please say aye.
Aye.
Thank you.
Aye.
Aye.
Aye. All right. Thank you. Okay. All right. Any abstentions or nays?
I abstain. Camille abstains.
Thank you, Camille. Any nays? Okay. Thank you. So that passes. All right. Shane, back on to you.
The poll to adopt the slate as amended is open.
All right. Thank you.
Just waiting on a couple more votes.
Absolutely. Thank you.
The slate is adopted as amended, 8-3 abstentions.
All right. Thank you. All right. So the next slide.
The next slate is theme 2, modernize and maximize public health engagement, communication, data, and information technology tools. And this includes the recommendations labeled on the screen, including visibility of public health, public feedback, central community portal for data, local health department public information officers, language access support, plain language support, health communications tools modernization, commission on data and information systems modernization, establishing a 5-year enterprise data and information technology system plan, efficiency of business functions, public health record digitization, centralized data repository, state electronic health record system, uniform data standards, hub and spoke model, data use efficiency, and conducting a laboratory system assessment. We'll now entertain discussion.
Thank you, Shane.
Can I just make 2 comments?
Please, Matt.
I was looking at the language in the full report. The only things I would maybe offer for the central data repository that says including healthcare, health departments, and other social service providers, I might just suggest adding other relevant providers, including social services, because actually it comes from a conversation I had this past weekend with the justice system, and there might be opportunities to bring in other data pieces to that as well. So we shouldn't necessarily limit ourselves to those. That's one suggestion to the language. And then the second suggestion, and I think it's relevant because you're voting on the slate, but the slate is based on the language in the report.
Yeah.
So the other one that I was looking at that I might just put a suggestion again is the state electronic health record. It says can integrate at a minimum the 6 core foundational public health areas, and I'd be very careful about putting that language in because environmental health is often problematic in trying to create a system that does everything. So I would just maybe amend the language to say that that can integrate as many of the 6 core foundational public health areas as possible, or something like that, so that you don't cut yourself off and say, well, all these systems don't do it, therefore we're not going to do it. So that would be my suggestions.
Thank you. So just to clarify, the first one, which for others on the call, page 16, right? To include, so you said social services, right?
No, it already says social services.
Social
I was
service-
just saying and other relevant providers,
Okay,
or
okay.
or social service and other relevant providers.
And other relevant providers. Okay. And the second one, okay.
I'm looking at
Can
the
you
broader
state the
page.
language? I'm sorry.
It's the next page, Tosin.
The next page. Oh, okay, okay.
03-5.
Okay. DIT. Can you repeat the DIT number again?
035.
Oh,
State
035.
Electronic Health Record System.
Oh, okay. I see it right after that one on page 16 still. But so can you just repeat just the language that is preferred, and what line is that? So input counties.
It says determine and purchase the universal health electronic record platform for MDH and all LDH that can be integrated at a minimum the 6 core foundational public health areas, and I would recommend that can integrate as many of the 6 core foundational public areas as
Okay.
possible, adopted by the Maryland Commission.
Okay, thank you. All right. Any okay, I think that is Mina raising her hand.
It was just a second.
Okay, second. Okay, all right. All right. Any additional comments or discussions about the amendments which are within the recommendations? All right. So can we please take a vote if there are no additional discussions, just to keep the flow going?
Really quickly. So I think Mina actually is the motion maker in this case, and we need a second.
Okay. All right. Can we get
Thank you, Shane. Sorry.
A second? Thank you.
More seconds.
Okay. Thank you, Mara. All right. If there are no discussions or additional comments, we'll take a vote on that. For both.
Aye.
All right. Thank you. Okay. All right. Okay. Thank you. I love that we're doing this. Thank you. This is great. Yeah. This is that opportunity that we have. So yeah. Okay. Thank you so much. Shane, on to you with the poll. So.
Is there any other discussion on the other recommendations? If not, we can move to vote on the slate as amended.
Okay.
The poll is open.
Thank you. Okay.
Couple more votes.
Okay.
The slate is adopted, 7 yes, 3 abstentions. Or I apologize. Late breaking vote, 8 yes, 3 abstentions.
Awesome. Thank you. Okay. Moving on. Okay.
The next theme is theme 3, leverage and formalize partnerships. This includes recommendations on social services, housing, aging, and transportation collaboration, academic health department partnerships, MACHO partnership, community advocacy and professional organizations partnership, which is noted as a recommendation that received substantial updates based on conversations with several organizations, including MedChi and the Maryland Academy of Family Physicians and other public comments that were received. So the language was updated to be more expansive and inclusive in terms of potential partnership opportunities. Collaboration with private health systems and Public Health Business Advisory Board. We will now entertain discussion.
Thank you, Shane. I see Dr. Krum has a hand up. Just to direct people's attention, it's between pages 18 and 19. Dr. Krum, please.
Thank you. For a point of clarification, in the one PCP 067 that did receive, is amended a bit. Can you clarify for me if the EQUIP program that is mentioned there is the general EQUIP program, or is it the primary care EQUIP program? Because those are two different things. And I know it says here primary care initiative, so I just want to make sure I'm understanding, because one might not exist in the future. And so I think we just want to be careful about what we're putting in. Do you know which one they were referring to?
I know that we were talking specifically about primary care at the time, but I don't know that we distinguished that there were nuances there. So I will look to my colleagues or Mina, who was able to.
Mina, please. Thank you.
Sure. Thanks for raising that. My understanding, it was broader than primary care, or not restricted to primary care because of the inclusion of prevention and primary care initiatives, as well as which advance public health and primary care access. So while the recommendation is a lot of the recommendation is inclusive and specific for primary care, it's not limited to primary care, the recommendation.
Thank you, Mina.
Right. No, I think that's great. But the EQUIP program, the sort of traditional EQUIP program is around specialists and especially referral and management, right? That's not prevention at all.
Right.
Primary care could do prevention, but the primary care EQUIP program is the one that is likely that is not continuing perpetuity. So do you need to have EQUIP mentioned there, or could that be amended out just to protect it from being something that is no longer an actual program?
I think, that's up to this group of commissioners, what they want to include in the language of the recommendation. Something may be nixed at a certain level, but I think it's up to the commission to determine whether we recommend that an initiative continue, because there's value to the initiative, even if it's not continuing through the current mechanism that it was slated to end through, I guess. So I'll leave it to everybody to vote on that. If you want to make a motion to remove that, we could certainly do that and entertain that as a vote.
Oh, yeah. Yeah, good idea. Dr. Crum, would you like to make a motion to remove that?
No, I mean, if this is what was developed, for just a point of clarification, if it is referencing primary care equip, it is not something that is likely to continue. The other equip program certainly would. And just only because you have prevention and primary care above before you mention the equip program, just wanted some clarification there.
Thank you. Thank you, Dr. Crum and Mina. All right. It looks like we're going to keep the language there. Are there additional comments or thoughts about this before we take the vote, or any other recommendation before we take the slate vote? Okay. Chris, I saw your hand. Were you raising your hand? Or no? Okay. Thank you. All right. Okay. It looks like there are none. Shane, on to you.
Okay. The poll is open to adopt the slate for theme 3, leverage and formalize partnerships, as presented.
Thank you.
Just a couple more votes. The slate is adopted, 8 yes, 3 abstain.
Thank you. Thank you, everyone. All right, next slide, please.
Right. The next theme is theme 4, bridge public health and healthcare service delivery. We begin with substantial updates to the primary care workforce support recommendation. A significant conversation occurred with several partners, as well as some open comments that resulted in this ultimately being reshaped into a recommendation that looks to study the issue around the primary care concerns a bit more thoroughly, and bringing together several initiatives in that vein. So I encourage you to look at the recommendation language more closely on that to make sure that you have the latest read on where that landed. The next recommendation is public health and primary care continuum, public health navigators, and elected official onboarding. We will now entertain discussion.
Thank you so much, Shane. And just to note, the recommendation on primary care workforce support is on page 20. And I see Mina has her hand raised.
And I think it's important to understand, or at least raise the context around that first revised recommendation, in that while there have been previous efforts to look at the primary care workforce in the state and to make recommendations for improvement of that workforce, and I'll call out specifically the previously legislated commission to study the healthcare workforce crisis, which I believe Senator Lamb on this call was a part of that commission, if I'm correct, and which I believe also had a primary care workforce kind of study group. And if you look at the final report of that commission, I believe on page 24, there are some specific recommendations related to the primary care workforce. I think the intent of this recommendation was to build upon that previous work, but do a more in-depth study of the entire pipeline, or so to speak, or to consider the pipeline of primary care workforce, not just the retention and payment models, suggestions, and so forth that might assist with the primary care workforce in the state of Maryland. And the reason why this is coming up in this commission, as we have discussed, I think quite a bit in previous commission meetings, and certainly the discussions have happened at work group levels, primary care access in particular in our local jurisdictions has such a relevance on the pressure on our public health system. So our public health system, when primary care access is insufficient, which it is pretty much in most, if not all, of our Maryland jurisdictions, there's greater pressure then on the public health system to ensure people have access to clinical services, preventive clinical services, and a whole host of health and wellness management. And so in the spirit of understanding how those access to primary care limitations pressurize the public health system, we really feel, for those that were involved in this recommendation, really felt like there needs to be some better understanding and enhanced strategies to address the primary care workforce in Maryland if we're also going to be supporting the capabilities of the public health system in Maryland.
Thank you so much, Mina. That's very insightful. Are there any responses to that or any comments in general regarding the primary care workforce support recommendation? Okay, hearing none about the new language, I'll pass it on to Shane. Thank you.
All right. There are no other comments. We will open the polls to adopt the slate for theme 4 as discussed.
Thank you.
Right. The slate is adopted. 8 yes, 3 abstain.
Thank you so much, Shane, and thanks everyone for the votes. All right, we can move on to the next slide. Thank you. Theme 5.
Our final slate to adopt today is theme 5, pave the way for current and future public health leaders. This slate includes the recommendations for Public Health Workforce Commission, statewide public health workforce training strategy, information technology and analytics workforce investment, Maryland Core to Public Health Careers, and youth education, public health literacy. We will now entertain discussion.
Thank you, Shane. And the editors on page 22 of the themes document, just for your reference. Are there any comments or discussions about any of the recommendations on the screen or regarding the amendments to Workforce 012? We'll give it a few more minutes, and if there are none, we'll move on to take the poll. And after that, I can take a deep breath, and you can join me in taking several deep breaths because we've gotten to this moment where well, I'm going to hold my excitement. We've come a long way, to get to this point. So it is exciting. So I'll hold my breath. And when we take the last vote for Team 5, and yeah. All right, looks like there are no comments. Shane, please, let's move on with the vote.
The poll is open for theme 5 as discussed.
Thank you.
Okay. The slate is adopted with 8 yes, 4 abstain.
Awesome. Thank you so much. Woohoo. Thank you. And that is it, right, Shane? That concludes all the recommendation slates. Thank you. Thank you to our work groups. Thank you, everyone, for this, for this effort. All right. Time for a break. At this time, let's take a 10 minutes break. We'll reconvene at 3:28. Thank you. All right. Welcome back, everyone. Thank you for still staying on the call. Hope you enjoyed your break. Okay. I'm just gonna give a few more, seconds for additional people to come in, and then we'll continue with the plan for the day. All right, I see a lot of people are back. Okay. Once again, thank you. I will now welcome Sarah to introduce the final report and discuss the structure, next steps, and timeline. I just wanted to note, before Sarah takes the floor, that this is going to be our last collective opportunity, right, to review this report. So we really, really are looking forward to your input. That's why we want to spend at least, the remainder of our time really delving into this report. So please take your time, open it up, on the side. Let us know where, what we think we can add or remove. And, I just wanted to make that note. Thank you. Sarah, on to you.
Yes, thank you very much, Tosin. Yeah, we are very excited to be able to share with you all an updated version of our final report. This was shared with you prior to the beginning of this meeting. The latest email that you got from Shane also would have this version of the report. And also a thank you to everybody who provided edits to the last draft of the report. We are hoping you will see those reflected in this updated version. A, a couple disclaimers to put out to share as we are reviewing this report together. Just as mentioned, this is a draft, so this is not completely finished. You will see that there are a few areas that will still need content. We tried to make that clear in the comments whenever we have those areas. Also, as you look at the report, notice that it is not designed. We are working with a professional design team to create a dynamic and engaging looking report. This will especially be in the recommendations section that I think everybody will be very pleased to see. We do not have that at this phase, but we will be able to provide that prior to our final meeting. Also, we will have copy editors review this report. So as you are looking through this, you may notice some copy editing issues. But just to please let you know that we are going to have someone go through this with a fine-tooth comb, so you do not need to worry about things like acronym, consistency, spacing, labeling of images, or other small format issues. Those are going to be addressed in the next version. At this phase of the report, so we are coming up to a final vote on our next meeting at September 25th, with the report being submitted on October 1st. So we do ask that your feedback be as specific as possible. So if you are sharing feedback to us, please track your changes when possible, provide specific language or specific content that you would like to be added or changed. If for some reason an editor suggestion does go beyond that, we'll do our best and to accommodate, but we very much appreciate being as specific as possible. So looking at this timeline to talk once again more specifically, you had a draft was shared on September 10th, and we are looking for edits to this draft to be sent back to us by September 18th. So we will be reviewing together during this meeting, but you will have an opportunity to review at your own time and on your own pace to give those specific edits. But we do ask that you send those to us by the 18th. We are also asking that any dissenting comments, as mentioned before earlier in this meeting, be provided to us by the 18th. Since the slate was voted on prior to this, during this meeting, just a few minutes ago, that has been set in stone besides the edits that were discussed today. So I would say when reviewing this final report, please keep in mind that the recommendation language itself is not to be further edited. That is finalized. Although I will do a disclaimer and say that the version that you received, that is in the draft final report that you will be reviewing, is not the final version of all the language. So I would say if you want to look at the most up-to-date language for the recommendations, please see the slate that was sent to you. That would not reflect the any edits that were done today. We will make sure that those are reflected. But the recommendation language in the final report, since draft that is provided, it is not the final recommendation language. And then just once again to remind everybody, September 25th will be when we do the final adoption in Annapolis in person for this report. That will be a final time to review the report together. If there are any final small edits that need to be made, similar to the fashion that we've done it with the recommendations, those can be discussed and it can be the report can be adopted with any small edits. But we would appreciate as many edits to occur and be sent to us prior to then. We want September 25th, of course, to go as smoothly as possible. And then October 1st, very exciting day. That is when this final report will be submitted. So I would like to take a little bit of time. I'm not sure how many of you have had a chance to look at this draft of the report. I know it's only been a day, but I would open up the floor for any initial impressions or thoughts about the report that anybody has. Afterwards, I will be quickly doing a high-level review of the report to talk about the different sections and try to see if anybody has any thoughts about that. And then once again, following the meeting today, you will have an opportunity to provide written feedback and edits that will be implemented in the next version of the report. And we are asking for that feedback by the 18th. And you will get a updated version to view ahead of that September 25th meeting, which will be the official vote before the 1st. So I will take now that moment to see if anybody has any initial thoughts. Yes, I see we have one hand raised.
Yeah, I believe it's Mina.
Hi, thank you. I just wanted to again applaud the whole team that's been working on this report and drafting it out, including the commission support team, all of the input that's been gathered from the assessment team. And of course, those who've had an opportunity to contribute to language from the work groups and so forth. So I think the thematic, strategic objective and organization of the report is one that really helps to pull together into a more comprehensive picture how the recommendations will influence public health capabilities in the state. So I really appreciate the thought that went into that and how we arrived at those. I also, just really appreciate, I do think that we'll need to ensure in the next couple of weeks that we have citations included in the report that reference materials that the work groups have reviewed to come to their conclusions, not just the assessment data, which was incredibly important, but also, presentations that they may have had at work group levels or at commission levels, as well as specific articles or evidence from the public health literature.
Thank you, Mina.
Perfect. Thank you, Mina, for that feedback. And we will say that we will aim to do that as we are able. Some of that, we have some record of that from the work groups, but not all work groups had the same level of recording or same level of for that, but we will work to get that as we are able to. Yes, Mina again.
Yeah, sorry. But I just wanted to, um, I know the length of the report has been a discussion point at previous commission meetings. I do, my opinion may not certainly be, the opinion of everyone on the commission, but I do think it's important for us to reflect the incredibly substantial process we've gone through over the past year and a half, 2 years almost, and uh, capture all the input that we've gathered through the assessment process and reflect the deliberations of the commission and the work groups of the commission. And so I actually appreciate the length of the report because it gives the entire picture and it helps me understand how the recommendations evolved. While I understand not everybody who's interested in this is going to read the entire report, that's why we have an executive summary of that report in the beginning, and we are looking at creating some briefs, particularly for our elected officials who want more topical information. But the report in totality to me is a great record of all the work that's been done and all the findings from this process. And I know as a local health officer, it's one that I'm going to use on a regular basis as we look at what we can do locally, at least, in improving our public health capabilities and services.
Thank you. Thank you, Mina. I also just want to add that to bring more life to the report, I think we should include pictures. We had a ton. We had pictures from our site visits. We went to Indiana to meet with the team. There are many pictures and pictures with some of our guest speakers. Those can be embedded, in different sections to just add more color and to tell the story in a different way. Thanks. You're muted, Sarah. Sorry.
Yep, thank you, Tosin. I don't know if anyone else has any other commissioner has any other thoughts. And as I said, I might be not sure if everybody had a chance to look at the report. But I'll give just a couple more seconds for that. All right. If it sounds like there is nobody else with any initial larger comments, as I mentioned, I'll go through the report at a high level just to discuss the different sections and to aid in the commissioner's future review. Shane, I don't know if you want to pull up the report or I can pull it up on my screen, whichever way it's easier.
I think I've got it up, but let me know if it's
Believe you've got it. You have it up. Maybe if you wouldn't mind zooming in a little bit more. Great. Perfect. So we'll just go through the report quickly and please feel free to interrupt, raise your hand, or ask any other questions. You should have this also as in your email as well, so you can look into any more section in more detail as needed. But to start saying that the title we've have here is Building the Future of Maryland Public Health. See that as the goal of this commission. And as you scroll down, you can see in a quick glance of what is all covered. We tried to really capture the different sections of the report in a very clear way of saying what we did. So talking about what the commission is, the state of Maryland, then the need, overviewing what is what we have found in Maryland through our assessment activities, through the work group and through the academic partners, and then narrowing it down to the commission recommendations, and finally our plans forward that we recommend from the commission. So, and then we also have a very hearty appendices, which includes lots of information about the methodologies, about the presentations, and all the other information that somebody would perhaps be looking for if they wanted to go into more depth behind the research that informed the commission and these recommendations. So continuing to scroll down. As mentioned, we do have a couple sections here that have not been filled out completely. We have the letter to the Governor and General Assembly, which we did not think was appropriate to complete until we had a more finalized recommendation slate, and so that has not been drafted yet. We are looking for remarks from all of you as commission members. I believe Shane has already begun reaching out, but we will follow up as well after this meeting. We would love to hear your specific thoughts on why the work of the commission was important, why you believe that the recommendations are important, why transformation of public health and is important, especially given the current political context is something that is still valuable. So we are looking to personalize the report in that fashion, and to highlight you all as individual commissioners in this section. So we will be following up, but would definitely encourage you to start thinking about what you would like to see in this part here. And then we have our acknowledgments, looking at all the various groups and people who have contributed to this work. It is, as mentioned over and over again, very much a work, cross collaboration of many, many different entities. So just to continue. And then we do have an executive summary, which will really give you that bird's eye view. So we're attempting to, of course, very quickly summarize everything that's in the report. So we can keep on scrolling through that. The charge, and a lot of this would probably be familiar to you who were part of the creation of our interim report. So there's a lot of similar crossover of materials, especially when speaking to the why the commission was created and the needs that were identified in Maryland. We also then, in this, right at the beginning of the executive summary, did want to go ahead and provide a bird's eye view of all the recommendations organized by theme and by strategic objective. So anybody who is looking for just very quickly seeing all of that at once can see that right there at the beginning of the strategic in the summary. This, of course, does need to be finalized based on conversations from today. But just as you could see how it would appear right at the beginning, because as we are creating this report, we recognize that the most important takeaway is the recommendations, is the suggestions that we have for transformation in Maryland. So we want to make sure that that is emphasized as much as possible. So continuing. So as we mentioned, just talking about what we did. So this section really laying the foundation for why the commission exists and who the commission is, and what it aims to, the purpose of what all of the work groups and what all they're trying to achieve through the commission and through the recommendations. So as you keep on scrolling, you will see all the information there, the commission charge and process, which will include, as you go further down, the a description of the work groups, a description of the vision, mission, and values, which were voted on and approved by you all as commission members earlier. So those are all here at the beginning section. And we do continue to include health equity since that was identified as one of the values of the commission. We then talk about the various assessment methodologies. Throughout the commission, we of course are very aware of the academic assessment, which was done with our academic partners, but an acknowledgement that when we speak about the assessment done by this commission, we are talking about so many different aspects. We're talking about these meetings, the commission meetings, the work group meetings, the development of the framework for the commission and for the assessment, and then of course all of the different parts of the assessment, including the listening sessions and the conception and the and everything that was included in the final assessment report. So this is really working to add that to really share how thorough the work was done here, so that any of the readers of this report can see all of the effort and all the different ways in which this commission worked to make sure that they were considering different angles and consulting different groups, including the public feedback, as well as their listening sessions, the site visits. And then, of course, even at the end, the public comment period and the response to those public comments. So through this, hopefully, it is very fully conveyed all that how thorough the work of the commission was. Then, based on that thorough work, we identified the need. So, looking at the need in Maryland, a lot of this section was pulled from the assessment report. So those of you who have recall the presentation from the academic assessment team, as well as the academic assessment report that was released, would see a lot of that information being reflected in this section as well. It is not, of course, everything from that report. We wanted that report to exist on its own, but we tried to make sure that we also included a lot of the findings from that. So yes, as mentioned, I think you'll find a lot of this to be very similar to the assessment presentations that you've already seen, both from work groups and from the academic partners. Especially when we come to the findings here. The findings are organized by work group, as well as other key areas for the commission, so that we did keep those organized in that fashion. So beyond the work groups, just to pause for a second, Shane, we do have the cross-cutting findings once again, as you saw in the assessment report, that did not fit perfectly into any of the one specific work groups. We did have some select, and just to pause again, select issues here. So you see COVID response, I believe emergency response, and maternal health are also in these areas here. Those were specifically called out in the charge for the commission. So that's why we wanted to make sure that they were very clearly outlined in the findings. And pause Shane here. So one section that is new that we welcome any thoughts or input is these areas for future exploration. So these areas here for future exploration is where we tried to capture some of the recommendations that are that did not make it all the way through the commission process, whether for various reasons, whether that's because we did not believe we had enough information about them, as well as other areas that we feel like we were not able to fully research just given the time constraints or other restraints that are in the commission. So this section acknowledges some of the limitations of the commission and some of the other areas that we believe that could be explored more, perhaps by future groups or future commissions. But we wanted to be as specific as possible in this section. So definitely would welcome any of your thoughts to this part especially. As well as this was a place to capture some of those things that were not fully created into recommendations that we believe still deserve some consideration. Okay, now quick pause here. So this section should look pretty similar to everybody here because it is very much similar to the slate that we have been developing and has been sharing. So this it provides a bit more context about the recommendation process and about the organization of the recommendations. But ultimately, this is the introduction to the slate. And to all of our recommendations that have been organized by theme. So this speaks to the creation of those themes as well as goes into more detail about each one of them. A point for everybody, if you did not, sorry, keep going down, Shane. Yeah, I got ahead of myself a little bit. Um, to pause here for a second, thank you. If you have not seen already or noticed in the slate that was shared, we do have each of the recommendations, but we are also providing short narratives to help contextualize a lot of those recommendations. So through this voting process, through the creation of all these recommendations, we tried to be as specific with the language as possible, but we recognize that sometimes a little bit more explanation is needed to fully appreciate what those recommendations are trying to do or recognize how they fit into the larger picture of Maryland's public health. So we have attempted to do that by providing these short narratives. There's short narratives following each theme. So summarizing each theme, speaking to how it is relevant to the work of the recommendation of the commission. And then for most of the strategic objectives, also speaking to the larger viewpoint or purpose of the objective and how and why the more specific recommendations are being grouped together and how they are connected to each other and help create a more a more intense picture of what we're trying to create in Maryland. So I encourage all of you, if you have not had a chance to read these narratives around the recommendations to do so. This is also where we were able to put some of that specific language that maybe started in a recommendation or that was suggested for a recommendation that didn't quite fit into that recommendation itself. We're, as you all know, trying to balance being both specific and sometimes a bit vague in the recommendations. So some of that language was put into these narratives. So definitely appreciate and welcome your thoughts on these sections as well. And you will see that throughout the slate that was sent to you and as throughout the draft report as it was sent to you. And thank you, Shane. Yes, so just going through that section fairly quickly because it should be something that you are familiar with. And then we have the final section of the report, which is how do we do this, which is really looking to speak to the next steps of the commission. Although this report is being submitted, of course, on October 1st, I believe it is everybody hope and intention on this call that that will not be the end of these recommendations. That will not be the end of the commission. We are looking towards the next phase of trying to make these ideas a reality. So speaking to some language of how we hope to do so, how to work with partners and to engage others into the work here of the commission, as well as just trying to add any final context or ideas that we felt are needed to understand how to aid any future implementation work. So that's what this section is. Once again, very much hope and encourage for any thoughts on this section. And then we would move into the appendices, which has many different sections here. Shane, we can quickly go through it, or everybody can look at it on their own. But we do have some detailed methodology provided by the academic assessment team. So speaking to who, listing out interview questions, listing out who was in focus groups and who was in who were being interviewed, just to provide some more of that context and support for the findings that we have listed in the report. We do have a summary of speaker presentations. This currently is presentations that were made to the commissioners. So these are speaking to all of the experts that were consulted. And then we have a list of membership. I would definitely encourage everybody to look through and make sure you are being listed correctly. Please, if there are any errors there, know that they were not on purpose. And if you notice anything, please let us know as soon as possible. We will definitely make sure to correct that.
Yeah. And just Sarah, if I might chime in.
Yes, absolutely.
I think the membership roster does need some updates.
Okay.
And we'll work on getting that updated to be current for the final report, and then hopefully to reference previously serving commissioners as well as previously serving work group co-chairs.
Thank you, Mina.
Thanks, Mina.
Just to reference back to if anybody is interested in knowing this, the reference to the code and codes of Maryland regulations for MDH and LHDs, having that as a resource here. An updated Department of Health organizational chart. Once again, please let us know if anything looks incorrect to anybody. We are doing our best. We do have a timeline of some related health efforts. This was included in the interim report, and we have worked to add some updates. And then in this final section here, which has not been fully updated and has not been designed, we do intend to have a very robust and easy to use listing of recommendations organized by work group, with some information about that. So to once again provide a very quick and easy to use list of all the recommendations, for anybody who is perhaps looking to go through and try and work on implementing these recommendations. This would be a very quick and easy spot for them to find them. So we're looking to make that as easy and as clear as possible to use. Once again, we do need to make sure that language is all correct for the final version, but this is just a placeholder at this time. And I believe that's everything until the end of the report here. We will also be adding responses, public comments here as in the appendix, which was part of the charge of the commission. So that will be included, as well as if there are any dissenting comments from you all as commissioners, that will also be included in the appendix. So,
Sarah, if I can chime in on that,
please do.
just since you brought it up. So after today's
Thank you, Sarah.
meeting, we will be sending out to commissioners this form that they can use to draft any dissenting comments on specific recommendations. What we did is aligned this to the language of the statute that talks about the dissenting comments from the recommendations being included in the final report. So in order to help facilitate that, making it into the layout and the graphics designers being able to pull it all together, we thought having a bit of structure here would be useful. We also wanted to remind folks that, this is a public document that will be going to the governor and General Assembly. So of course, being mindful of how things are characterized and so forth, that it's not necessarily just going to the co-chairs for review, but a much larger audience. So if there is any recommendation that rises to the level where a commissioner feels they need to remark on it, this tool is available, and we'll send that out to you. And you can get it back to us before September 18th at 5 p.m., which will give us time to work with the graphics designers and other folks to get that included in the final draft.
Thank you, Shane. And thank you, Sarah, for the wonderful presentation. It was very thorough. Would that be the end, or is there additional?
That is the end. I would
Okay,
open it up
awesome.
once again if anybody has any comments or concerns. I know that was high level, and we did not provide everybody an opportunity to really dig into the details. I hope that was helpful, just to understand what all we're trying to achieve with the report. But please share any thoughts that anyone has based on that review if you have it. Otherwise, as said before, we are looking for edits and other additional comments by the 18th to be integrated into the 25th version of the report.
Thank you once again. Really appreciate it. So at this time, I would like to open the floor, to our commissioners for initial thoughts and feedback regarding this draft final report presentation. We welcome your reflections, questions, and recommendations as we move forward to finalizing this important work. I'm going to be calling on names, because we really, really want to hear from each and every one of you. And if you don't have any specific comments, just say you don't. But let's go on with that. So Delegate Heather Bagnall.
I don't have relevant comments than to say thank you all so much for your diligent work. It's been an honor to serve on this commission and see the breadth of work that has been done. And we are creating a really important roadmap for the future of public health in Maryland. So just thank you all.
Thank you so much. Very well received. Miss Camille Blakefall. I don't know, is Camille still on? If you are on and speaking, you're probably on mute. Shane, can you please confirm that
I
Camille
don't
is
see
on?
her
Oh, you
on.
don't see her? Okay, all right. No, that's fine. I'll go on to Christopher Brandt. Any comments, reflections, thoughts?
No comment, question. It's been an honor to participate. Excited to see the report and see see if we get some traction going forward.
Thank you, Chris. Appreciate all your support and contributions. Mina?
Just echo the comments I made earlier, which I just really want to express gratitude towards all of that's of course the commission support team, the partners, the work group members, and of course all the commissioners and others who've contributed to this process, including those who've contributed in the public comment period and the listening sessions. Thank you.
Thank you so much, Mina. Jean Tremont?
She's not on.
Oh, she's not on. Okay, all right. Senator Lamb?
Yeah, thank you. Just wanted to similarly echo others' comments as well, and certainly appreciate the work of all of the commissioners and stakeholders, members of the public who've been involved over the last year plus. I know this has been a labor of love, but it's also been a really important initiative for us to be able to have a good roadmap, given the challenges that we continue to see in public health, and know that your efforts, will carry on in the activities of the department, our many other commissions and agencies, as well as the General Assembly, who, will continue to work on these recommendations to spearhead really important efforts that need to advance here when it comes to public health in the state of Maryland. So just want to thank all of you for your efforts. And it's really remarkable the distance we've come as part of this commission to come forward with these recommendations, this report. Look forward to seeing everyone in Annapolis next in a week or two.
Yes, looking forward to seeing everyone. Thank you for those comments, Senator Lamb. Appreciate it. Deputy Secretary Alisa Lord, or the representative. Okay, I don't know if the representative is on. Shane, can you please confirm?
I think she might have dropped off. It doesn't.
Okay, all right. Okay, thank you. All right. Boris?
Yeah, the usual in terms of putting this into perspective, that what we started with a long time ago was an idea. It was a piece of legislation. It was handed over to us as a commission, and this was a team effort. The commission's work got expanded quickly with additional levels of support, and this goes beyond just the support that we see from groups like the CDC Foundation, the Beaumont, and others that are listed in our report. It goes into the volunteerism of the people around us. I mean, OMG, right? When we look at the 100+ people involved in the working groups, the working group leads, right? This was, as Senator Lamb said, a labor of love, right? And yes, it was a pain in the butt occasionally. And yes, this was hard and frustrating work at times. I also want to remind the group that the legislation doesn't sunset our commission until June of next year. The hard work is over. But the co-chairs will be meeting shortly to discuss what is the next phase of this commission. Does that mean monthly meetings? No, it's not going to be. So we are going to get a break out of this. But don't forget, we go into this next stage, which is a briefing stage. It is a getting the word out about this stage. And so, what we pledge as the co-chairs are that we will keep you in the loop on things and we will embrace your further activism. Will we force things upon you like we've done with, roll calls and meetings? Probably not. We may have a meeting or two in the future if something were to come up. So be ready, right? You still have the ability to serve as a commissioner until all this sunsets per the legislation. Update your CVs with two things, right? Update your CVs with the closing date of this commission, June of 2026, because that'll remind you that you are giving yourself credit for remaining an activist on this. Update your CVs with your role on this commission. And why am I stressing the CV portion? The CV is a way we define ourselves in our world around us. Take credit for the work that you've done, right? Ultimately, this report is done by all of us. Yes, we've handed off parts of it to groups out there. This is a group endeavor, but you have played a key role in this. As mentioned already, we would love to see everybody in person at the next meeting. We're not even offering a hybrid version, I hope, of that meeting. It is a celebration. Please get it on your calendars. We'll have the ability to, reflect, to give out handshakes and to be able to celebrate the final rendition of this report. So thank you all for a job well done.
Thank you so much for those remarks, Boris. Appreciate it. And I already offered my remarks. In the interest of time, I will go on to Maura. Dr. Rossman, please.
Maura is fine. I don't know what new to say. Ditto to what everyone else has said. It really has been a pleasure and an honor and a learning experience being part of this commission. I want to thank the chairs, Tosin, Boris, and Meena, for all the work that they've done. And obviously, we wouldn't be here without you guys. So thank you for your time and effort, including the pain in the butt time, which we all recognize. And thank you to the staff for keeping us on track. And I just want to acknowledge all the new people. Like, this has been, some of us have been from the beginning. Some of us, we've lost some people. We've got new people. And all along, we were all along for the journey and the ride in order to advance public health in Maryland. So on behalf of a local health officer, I thank you for that.
Thank you, Maura. Appreciate it. Nicole, Dr. Rochester?
She's not able to be on today.
Oh, she's not? Okay. All right. Michelle Spencer?
Hi, thanks all. As Maura said, I'm not sure all of what more to add that hasn't already been said, but I think I just want to echo all that have been shared and really thanks Sarah and Shane for the hard work. I think Shane is probably over me the number of times I text him on the side, or Shane, what about, or follow-up calls after the meeting just for points of clarification. And so I just really appreciate all of you and the way that you all ensure that voices of community are centered. Certainly the way that voices of government and academia and all of the different spaces and the importance of all that there are reflected not just in the report, but in the process, which is equally as important as the final outcome of this. And so the heavy lifting and the travels all across the state and the way that we've done this work. And so just really appreciate all of you and really grateful for the opportunity to be in community in this space, thinking about the critical components of how we move public health forward in the state of Maryland. So thank you all.
Very well said. Thank you. Thank you so much, Michelle. Dr. Elizabeth Crum for Deputy Secretary Meg Sullivan.
I think ditto is the right word. I was a little late to the party on this one, but I appreciate all of the work that went into it. And just it does my public health heart good to see, to be able to be one with you in this final stage, and to see all of the work that's been done. And particularly, I mean, when I look back over just all of the work groups and how many people participated over a long time, I mean, that is a significant amount of engagement and a lot of work to keep it going too from the staff side. So thank you for this, and look forward to seeing how this moves us forward.
Thank you. Thank you so much. Alan Tweak.
Yeah, thank you. It's hard to add much else. It has been an honor to be a part of this commission. I think that we can be proud of the substantive body of work and these recommendations that really will point the way towards a stronger public health system in the state. But just thanks so much again to our chairs, to our staff, and all the members that took part in adding to this work. So,
thank you. Very well appreciated. All right. I think that ends the segment. The next part is announcements. So you've heard this, throughout the meeting. Our next meeting is on Thursday, September 25th, from 2 to 5 p.m. We really, really would love for you to come in person. We really, however, the meeting will be streamed. Boris will be the presiding co-chair for the meeting, and it's going to be in Annapolis. So more to come about that. Wear your celebratory outfits, whatever you want to wear to celebrate. Woohoo! That's the final adoption of the final report. And, so we are very excited and proud. As you've heard from all our commissioners, we're very proud of this work. So we look forward to seeing you. Okay, thank you, Delegate Bracknell. We look forward to seeing you. And feel free, show your excitement. But please, I'm making a special plea. Please come in person on Thursday, September 25th. All right. The last item, but before I make the last announcement, thank you so much for the chairs. Any question about, our last meeting? As you've heard from Boris, it's our last meeting, but the work continues up until June. And then, operationalizing it, goes on even after June of next year. So are there any final comments before we adjourn? All righty. Thank you so much. I will call for a motion to adjourn the meeting.
I move.
I figured, I saw your mouth. I knew it. Thank you, Michelle. Thank you. Can I get a second, please?
Second.
Looks like Maura. Yeah, thank you, Maura. For the record, the meeting has been adjourned. Well, let's get votes first. In case anybody wants to stay here, can I get yeas, nays? All in favor, please say aye to adjourn the meeting.
Aye.
Aye. All right, thank you. All right, for the record, the meeting ended at 4:21 p.m. Thank you, everyone. See you on September 25th. Bye-bye.
Thank you. Great work.